Hi, we have Dr. Teresa Sievers with us today, and she's our medical expert here, and we're here at our clinic. And today's question is about arthritis, but in specific is, I hope I don't butcher that, but it's called patellofemoral arthritis, which is arthritis of the knee, right?
Of the knee, basically.
Okay, so
we have a fancy word.
What is, I'm not going to say it again, we're going to call it arthritis of the knee. What is that?
Osteoarthritis of the knee.
Yep.
So basically, it's an arthritis that comes about, typically it's a wear and tear type arthritis. And the knee is particularly susceptible to it by just its anatomy. It doesn't have a lot of support, and you're using it all the time. It's carrying the weight of your body. People injure their knees a lot. They might have hurt their knee when they were younger. They got over it, didn't bother them. Now they're in their 50s, and that same knee all of a sudden starts bothering them again. Because when the knee or any joint gets damaged, it's more likely to become a problem as we age. And it can be very debilitating.
Okay, so for those viewers out there, what would you recommend from a supplement basis? Because some people are just, they don't want to take the drugs. They want to go the natural route first.
And particularly with osteoarthritis, I really can't stress enough that there is not medication that's treating that arthritis. It's really just putting a Band-Aid on it with significant side effects to you. I just had a patient who was in the hospital for a gastrointestinal bleed from using, and I told her not to use the NSAID. I won't say a name brand. She said, well, I only use it once in a while, doctor. I use it maybe once or twice a week. I don't use it if it's raining out. She actually almost died. She was in the intensive care unit from a serious bleed. So I can't stress enough going natural. So what do we do naturally? And the key with osteoarthritis is the more movement people get, the better they feel. But the problem is when they have so much pain, they don't want to move, and it gets worse and worse. So I like to go to Flexin. And the reason I do is because they don't have to take 3 different bottles of things to help them. They can start noticing some relief within the first few weeks. And it has a very unique ingredient in it that many products don't have. Because patients might pick it up and for whatever reason, because they see glucosamine, they recognize that word. And I'm like, that's part of it and it's important. But the key ingredient is the CM8, or what we call the acetyl myristoyl, and that's a fatty acid that has been found to really treat arthritis. Actually, originally when it was located in mice, they found out they could never give mice, because mice have this in them naturally, they couldn't get the arthritis, no matter what they tried to do in the lab.
And I think it was a specific brand, a strand of
albino mice. They
yeah.
cannot become arthritic. And so this product is great because it helps the osteoarthritis, because there is still an inflammatory component to osteoarthritis. And we have a destroyed joint. We need to build it back up. Once you get that CM8 in there, lubricating the joint, calming down the inflammation, now we can rebuild it with the MSM that has the sulfur in it, with the glucosamine that has the sulfur in it, which, by the way, the glucosamine is more absorbent than the chondroitin. And that's why I believe they put the glucosamine in that product. And also there's a little bit of digestive enzymes so that the patient can actually absorb the product.
Great. So you have CM8, you have MSM,
you have glucosamine, collagen. The collagen's in there to really coat the joint.
Bromelain for anti-inflammatory.
Yep, bromelain, and it's got zinc. It's got little calcium, little vitamin C, and those are just things that are nutrients and kind of fuel for the joint itself.
Okay, great. And I'm going to try it again. Patellofemoral arthritis.
You did great.
Okay, awesome.
Great.
All right, Dr. Sievers, everybody. Thank you.